Hi, I'm Beth Carl. I'm the Director of Simulation Learning here at Augustana University. We use simulation in our active learning classroom to bring learning alive. During simulation in class, students are able to interact with a patient just like a nurse would, from assessing the patient to providing interventions, including medications. They're also able to look at diagnostics real time to really make the best plan of care. One of the biggest things about simulation at Augie is that we use it differently than most schools. Most importantly, we use it for teaching and learning. So today we were learning about acute coronary syndrome, so a patient who is having a heart attack. Instead of multiple PowerPoint slides to present information, we wheeled a patient in to have a heart attack in the middle of class. These mannequins are physiologically responsive, so they act just like a real human and they respond to the students just like a real human would. The students were able to interpret the data and then intervene as necessary. Simulation is a great place to ask questions. It's a great place to make mistakes. That's where the learning occurs.